I was really excited to interview this week's guest because of his knowledge in nasal and oral hygiene. But turns out that Nate can teach us about more than that. We will get into all the details of how xylitol can benefit your health when you implement it into your hygiene routine. And Nate shares his own personal routine with us while recommending products. It's super helpful. But then we will chat about his legal battle with the FTC, and not only will you see that it is completely unfair, but you'll see the amount of manipulation, deceit, and hardship that companies like his are burdened with due to government regulations and bias. If this show has ever been of benefit to you, would you be kind enough to quickly leave a rating or review on Apple or Spotify? The links are in the show notes for you, and at no cost to you, you will be helping us reach more people with important info on natural health. So thank you.
Welcome to the Daily Wellness Podcast. I'm your host, Melissa Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. Hey, Nate, thanks for joining me on the podcast.
Well, thank you for having me. Hopefully it's a good conversation.
Oh, I think it will be. I'm excited to learn from you. I know you've been in the health and wellness space for a long time. And so I know you have a lot to teach us. And I'm excited to kind of hear a little bit more of how you got your business started and kind of the development of your products and what was the kind of heart and reason for all of that beginning.
Okay. That's do we have 4 hours? No. No, I'd actually got started because my dad is a physician. He's still alive, so he's still a physician. But he was actually just trying to find something to prevent children from getting ear infections. And to have a physician trying to find ways to prevent illness is actually a very big outlier, as we all know. But he did find something, and it was a nasal spray using xylitol. He came up with it because they'd already been doing studies looking at how xylitol prevents tooth decay, and very effectively at doing it. It does it in a completely different manner than what everything else does, but it very effectively just gets rid of the bacteria in your mouth that cause cavities. And we can talk about that later. But he started looking at the studies, and in the studies where they used chewing gum sweetened with xylitol, the kids in these studies, not only were they not getting cavities, but they were getting 42% fewer respiratory infections, ear infections, stuff like that. And so then there was a paper that came out in I want to say October of 1998, where they did where they looked at how that mechanism was happening. And what they found was that the xylitol was binding up on receptor sites and blocking the ability of these bacteria to adhere to the tissue in the upper airway.
Okay.
He put it into a saline spray, started squirting it up these kids' nose. They stopped getting sick.
Wow.
So I quit my day job and started a company in 2000. And here we are today, 25 years later.
Yeah. And how do you pronounce the name of your brand?
Xlear.
Xlear.
That was something my dad wanted. It clears your nose. That was what our first product was, actually the nasal spray. It clears your nose. He thought that was kind of catchy, so he said, I'll let you take it and start a company, but I want it called Xlear. And so it's called Xlear.
I was like, read the name. And starting with an X, I was like never 100% sure that I was saying it right in my head. So I was just had to ask that.
Xlear. I mean, we get all kinds of words, but, people do remember the name, so it's actually not bad.
Yeah. So when did you quit your day job and try to start marketing this as a product?
2000.
Okay. So you've been at this for 25 years.
The first part of 2000, yeah. The first part of 2000, our official incorporation date was June 6th, D-Day. So there you go.
Yeah, that's awesome. So the passion really started with your dad, and then you kind of caught the vision from him, and you guys have developed like several products other than the nasal spray since then, right?
Yeah, we sell. So the big body of science behind xylitol is actually in oral hygiene, and so Xlear is we sell hygiene products, oral hygiene, nasal hygiene. We haven't gotten into hand soap yet, but we've thought about it. We just haven't. But we sell hygiene products, and the big body of science is behind how xylitol gets rid of the strep mutans bacteria in your mouth that cause tooth decay. And the interesting part of that is that everything that you can go down to the store and buy that is an oral hygiene product, you have to have fluoride in it in order to be able to say that it prevents tooth decay. But fluoride doesn't even treat the bacterial infection. All fluoride does is it makes your enamel stronger, more resistant, but it allows that bacterial infection to fester and grow. And it's crazy. It's absolutely absurd to me, the story behind that I've just barely been digging into this whole history behind fluoride.
Yeah.
It's mind-blowing. Like, you thought there was some shady science going on in the last 5 years. Wait until you look at what the fluoride issue is.
Yeah.
Because as I dig into this, I mean, we sell a fluoride toothpaste. Fluoride, it makes your enamel stronger. You brush your teeth with it. You spit it out. But, you know, we'll get into that. But it's just interesting.
It is interesting. I've been saying no to fluoride at my dentist office for my kids for, I don't know, more than 5 years, since I started learning about fluoride and some of the harmful effects of fluoride, and that fluoride is actually a neurotoxin. And people would look at me like I'm crazy, and I would tell people, and even in the dentist office especially, they're like, make you feel like you're stupid for, not wanting fluoride. And then now I'm seeing it in the news. People are talking about getting fluoride out of the drinking water and things like that.
Utah, where I live, is the first state where it's going to be out of all of our drinking water.
Wow.
We just passed in the legislation up at our state legislature. Our state just passed it.
Yeah.
So let me go into that just for like even 3 minutes.
Yeah, please do.
So what started all this stuff in the news lately was I don't know if you're familiar with it, but in California, there was a case that went before a court, and they pulled up this Cochrane paper that the Cochrane Group, are you familiar with what the Cochrane Group is?
No, I'm not.
So the Cochrane Group, they do meta-analysis, which is you can go out and you can have universities and they do a study, and then somebody else does a study and somebody else does a study. And then you have a group that goes in and does a meta-analysis where they take 20 studies and they take all the data from 20 studies and they look at what that data represents as a trend. And Cochrane is one of the most respected groups in the world that does that. And so they actually came out with a Cochrane report, a meta-analysis, and what they found was that the effect of fluoride is about 4%. It reduces tooth decay by 4%.
Wow.
Okay? And the judge in California, which of course is a liberal state, said even that, you've got to go back and revisit the whole idea of putting fluoride in the water.
Yeah.
I've been in the industry for 25 years. I understand what fluoride does. I understand how it works. Okay, it goes in, it remineralizes your enamel. Fluorapatite is stronger than hydroxyapatite, so that's given. But I had never actually gone in and dug into the history behind it. And the interesting part of this is I said, well, how is it 4%? Because if you go in and ask a dentist or go on and do a Google search in the medical or the dental literature and say, what is the accepted rate of reduction of tooth decay if you use fluoride in your toothpaste and your mouthwash and in the water and in the pastilles and in the varnishes, and it's 20 to 30%. Okay? So that's what's been accepted.
Right.
And what's been working under for the past 25 years. This 4% made me go back and revisit that. And so I had some people on our team that went out, and I said, go back and find me all of the information about fluoride that you can find. And they were pulling up meeting notes from the American Dental Association meetings from the 1930s.
Mm.
And in the 1930s, the American Dental Association was adamantly opposed to fluoride, adamantly opposed to it. And their argument was you would have to use it in such a toxic level in order to see a beneficial return. Okay? Which we all understand that. And so they understood it in the 30s. And then it goes into the 40s, and the we're trying to find some of their meanings and some of their meaning notes to see where this change happened. But nothing happened that we could figure out. And then in 1950, the ADA gets fully on board and starts pushing fluoride in the water and the toothpaste and everything. And the only thing that happened in there is the Grand Rapids study. Are you familiar with that study?
Nope.
So in 1945, they put fluoride in the water in Grand Rapids. That was the first city where they ever did it. Within a couple of years, they were actually putting papers out claiming that they were reducing tooth decay by 60+%.
Wow.
Okay? If you go do a Google search today and just say, find me every dental research paper that shows that fluoride reduces tooth decay by over 30%. There aren't any.
Wow.
Because you can't.
Right. So how are they making these claims? Yeah.
That's stuff. I mean, in my opinion, that's fake science.
Right.
I think that they made it up because they wanted to have the result and they made up the data. And the ADA, the American Dental Association, should have been able to pick up on that. If they were adamantly opposed to it, saying, you're not going to get a benefit without having a toxic level, and then someone comes back and shows 60% of the data, they should have gone and said, hey, let's do this out a couple of times. Okay? One of the other things that's crazy about that is stop and think about it this way. The ADA, the American Dental Association, endorsed fluoride in 1950. That's 75 years ago. Okay? Go down to the grocery store, go down to the pharmacy, and find me a product that you can buy that says helps to reduce tooth decay, that is fluoride free. How many of them are there?
I have no idea. Is there any?
There's zero.
Yeah.
There's not a single product. The ADA has not allowed anything other than fluoride to be put on the market today and make the claim helps to reduce tooth decay if it doesn't have fluoride or prevents cavities.
Wow.
And it had fluoride.
Despite the research that's come out since then.
Well, we've spent, as a country, we have literally spent hundreds of billions of dollars over 75 years trying to find solutions to tooth decay. We haven't found any that the ADA allows to be put on the market. We know that xylitol works. We've known that since 1950, since the 1970s, that xylitol works. We know that erythritol works. We know that dental probiotics work. We know that you can use calcium trimetaphosphate, or sodium trimetaphosphate. You can use hydroxyapatite. There's a whole bunch of these products out there that have been shown to work, but the ADA and the FDA and the CDC don't allow them to be put on the market with any claims.
Wow.
That, to me, is more telling than anything else.
Yeah, it definitely is. Hey, Daily Wellness listeners, see if you have any of these symptoms: runny nose, sneezing, shortness of breath, nausea, bloating, constipation, or the opposite, hives, itching, eczema, joint pain. Anything along these lines could be a sign that you are having a histamine reaction. We often think that we just have allergies and we have to live with it. But did you know it's not something you just have to live with? My friend Heather has a new course that walks you through reversing histamine intolerance based off the GAPS protocol. It includes educational videos, tutorials, handouts, and meal plans. It also very generously includes all of her traditional food courses so that you know exactly how to make every food needed to reverse histamine issues for good. If you are ready to give up on the idea of suffering from allergies and histamine issues forever, check the show notes for a link to her course. And now back to the episode. And you guys have undergone some scrutiny, right? Because of like what they call claims, but that things that you guys have said or put on your product marketing or even put on your social media. I read some things about that they say you are claiming certain things that you really aren't claiming, etc.
Well, everything that the FTC, because the FTC is the one that's suing us, and everything that the FTC says is true. Okay?
Yep.
It's true. But the question is, and this is where the lawsuit comes from, and then we're talking about our Xlear nasal spray now. So we're talking, and so the background to that is, in 2000, when I started the company, we had a nasal spray. My dad had used it in his practice, reduced ear infections, and so I didn't know what I was doing. I just put out an ad in some of these magazines that said, "Hey, washing your nose with a nasal spray like Xlear helps reduce, ear infections by, I think it was 78, 80%." And the FTC sent us a letter. It was a paper letter back then. They sent us a paper letter and they said, "Hey, we need to talk. You can't make these claims because you don't have any studies published in the medical literature to back this up." And so we said, okay. So what we did say, and what they said we could say, was, you can say that xylitol blocks strep pneumo and H flu and MCAT from adhering to the tissue. And that's on our packaging. I'm trying to look and see if I have. I mean, it's even on our packaging. It's been on our packaging for 20 years. And the FTC, the FDA, they come in. So we were allowed to say that. And so for 20 years, we were like, yeah, it helps block these pathogens from adhering to the tissue in the upper airway. It facilitates your body cleaning all these bacteria and not viruses, these bacteria out. And then when 2020 came around, I don't know if you know this debacle that started in 2020, the FTC, we weren't saying anything about it. And then out of the University of Tennessee, there was a study that showed that xylitol blocked SARS-CoV-2 from adhering to the tissue. Okay. This was in early 2020. We sent that information to the government. They didn't do anything with it. Okay. There was a study that came out of Vanderbilt University shortly after that, where, and there's so many tangents to this story that it's crazy. So even prior to 2020, the CDC on their webpage had a place where it said the best, they were talking about respiratory coronavirus infections. And they talked about the way to treat a respiratory coronavirus infection was to use salt water, to use irrigation, to physically wash this virus out of this pathogen out of the upper airway so it doesn't spread to the rest of the body. Okay. In early 2020, at Vanderbilt University, they did another study showing that, yes, what worked prior to 2020 still worked after 2020. Okay. They took 60 patients, all of them over 65. They all had COVID. They all had other comorbidities. They all tested positive. They all had symptoms. They gave them salt water. Within a week, 100 of them were symptom-free and healthy and on their way. And everybody in our industry received a letter from the government telling us not to share that data.
Wow.
Okay. That's crazy.
That is crazy.
I'm like, why is this? No, I'm not. I'm going to continue to share the data. It's data. It's a study. And this is in May of 2020.
Mm-hmm.
They don't have any vaccine. They don't have anything else. And so we kept sharing that, and the government sued us for it.
So earlier, the FTC told you that you didn't have the research to back up a claim, and now you have research, right?
We have a lot of research now.
Right, to make some of these claims, and they're telling you that you can't.
Well, so that's the interesting part of it, is we were having these discussions with the FTC, and the FTC said, no, you can't say that. And I said, we have the data, and the FTC, I'm going to get the dates right. They sent us a warning letter in July of 2020. And so we debated back and forth with them, and it became fairly evident fairly quickly that they didn't care if we had the data. And it came out later, as they were being deposed for our lawsuit, that they never even read the studies that we sent them. Their argument, and I can't make this stuff up, it's that stupid. Their argument was, it's not in the news, so it can't be true.
It's not in the news, so it can't be true.
And they sued us. They sued us in October of 2021. And in December of 2022, the FTC came out with guidance and said, in order for you to make a health claim, you have to have 2 RCT studies. 2 for each and every health claim on that specific product. Prior to that, it had been You have to have studies backing up your claims.
Just
So
studies in general. Okay.
yeah. And so they sued us. And then a year and 2 months later, they came out with different guidance to go back and cover what they sued us over.
That doesn't seem fair. Nate, that doesn't seem fair.
Well, lawyers that did it have all left the FTC. I think they realized that they kind of screwed up and they left.
Wow.
So, but anyways, that was what the case is. But again, the FTC and the regulatory agencies, I've never had in 25 years of running a company in this space, I've never had any issues other than this one. And it really opened my eyes to almost the criminality of the regulatory agencies and what they're doing. They didn't care that, we pointed out that the CDC, their guidance was that. And the interesting part of that is we sent all that data over to the FTC and said, this is what the CDC says. 2 weeks later, that webpage was taken down off the CDC's webpage. Gone.
Wow.
So
this started in 2022 and you're still battling this?
Yeah, we're still fighting it.
Wow.
The FTC, the government, and this is something else that I learned. When we were deposing the lawyers that did the investigation for the FTC, we asked them, how long have you worked at the FTC? 23 years. Okay, in that 23 years, how many times have you written a warning letter to a company or a person, and that person or company gave you data, and you said, oh, yeah, you're right. You have data. And in 23 years, how many times do you think that they'd said that?
Probably none.
0.
Yeah.
Which means it's not a question of going after the facts. It's not a question of looking at the truth. It's a question of, I said you have to do this, and no matter what you give me, it's not going to be enough.
Right. So, I really appreciate you sharing this because I think it's really important for, me and everyone listening to understand the challenges that people who are creating natural or non-pharmaceutical products face when it comes to, just creating your product, marketing it, getting it out there, the claims that you can and can't make, the bureaucracy and the governmental red tape that you guys have to go through. And it kind of begs another question, though. And I think I know the answer, but is the government following its own rules here?
Well, absolutely not. Absolutely. When they came out and said, wear a mask, don't wear a mask, wash your hands, wash your fruit before you take it in the house, stand on your head and count to 30. None of that.
Studies to back that up.
They didn't have anything. They just made it up. 6 feet. And there was no even supporting data behind any of that. Yep. They just made it up. So, yep. and to point this out, we actually, in June of 2020, we went to the FDA and said, we would like to do a study looking at our nasal spray and people that are treating COVID patients in COVID populations to see if it works to prevent people from getting COVID. And the FDA's told us, no, you can't do a human clinical trial with a whatever class pathogen, class 1, class 3, whatever it is, biohazard number 7 or something, pathogen. Right. So they wouldn't even let us. We weren't even asking them for money. And they just said, no, you can't do that. And we think that kind of tipped them off because a month later is when we got our original warning letter.
Oh, wow.
So we think that us trying to do the right thing, going to the government, trying to help other people and show them all this data is actually what triggered them to come after us. We don't know because the FTC tells us that from the day that they sent the warning letter, there's nothing in their archives ever before that of them ever having discussed us.
Right. Well, obviously, just from your story and other things happening in the world, it's pretty obvious that the government has a pharmaceutical bias, right? That's obvious. Yeah, the rules, quote unquote, that are created are definitely biased toward governmental agencies and pharmaceutical companies.
It is, and to be honest with you, I really hope that Kennedy can actually do something to change that.
Me too.
Because when you stop and think about it, we as humans have been around for thousands of years. Okay, however long you want to go back, we've had pharmaceutical products, synthetic pharmaceutical products, for about 100 years. Okay. And in that 100 years, we become sicker and more dependent on those things. And we become more trusting of the medical establishment than ever before in the history of humankind.
Yeah.
Are we healthier today than we were 100 years ago? Not even.
Mm.
Not even close.
Not even close. Way worse, actually.
You're way worse.
Yeah.
But at the same time, if you go and you look back over the last 150 years, you'll have, I run a company, we sell hygiene products. But if you go back and if you look from like 1880 to 1980, there was a huge decrease in mortality. There was a huge increase in quality of life, the longevity of human life. And a lot of doctors and people in the medical establishment try to accredit that to the pharmaceutical products. But that's not true. It's 100% not true. If you go look up grass, what it is it's that we had clean water piped to our houses. We started learning about washing our hands. We started brushing our teeth. And if we start washing our nose, that would even go up further, the quality of our life and the longevity. I can't say about longevity because we haven't been doing it long enough, but the quality of our life and the incidence of illness is going to go down.
Yeah.
And so we know that. But even the FDA would not let us do studies. But in 2021, there was a paper that came out of India, and an English company. They made a nasal spray incredibly similar to ours. I can't help but think that they knocked it off, but it was incredibly similar to ours. They went to India and they did a study on hospital workers treating COVID patients. This was during the Delta wave. So arguably the deadliest wave at the deadliest place. And what they showed is that if you use a nasal spray like Xlear 3 times a day, once in the morning, once in the afternoon, once in the evening, your chances of even having the COVID virus in your nose went down by 62% above the saline placebo. And we already know that saline works, or we've already discussed that to some extent. And the endpoint on that wasn't whether you got sick or not. The endpoint was whether they could PCR test you for having the virus in your nose.
Yeah.
So if you can reduce you even getting the virus in your nose by 62%, that's pretty significant. The study that I mentioned earlier that was done at University of Tennessee, where they showed the xylitol blocked adhesion. The other ingredient that they looked at in that study was a seaweed extract called iota carrageenan. And what they showed is that it blocked it also. Xylitol was much more effective. But they did a study in Argentina in hospital workers treating people in COVID hospitals. And they showed that if you use it 4 times a day, it reduced it by 80%.
Wow.
All of these studies, and our government still, to this day, will not talk about a hygiene intervention for any respiratory illness. Okay? They won't talk about the oral hygiene interventions that are going to have to take place in order for Kennedy to actually make America healthy again. In the year 2000, the Surgeon General put out like a 340-page paper on the status of oral health in America. And in that, they pointed out that people use tobacco, they smoke. I think they mentioned the word sugar like 3 times. And I'm not kidding, 3 times. That was okay. And they're sitting there talking about how oral hygiene in the United States and the incidence of oral disease was increasing. Okay. Sugar, we all know that sugar is the number 1 cause of oral disease, right? We all know that. Everybody knows that. But they, in 300 pages, it was over 300 pages. In 300 pages, they only mentioned it a couple of times. They put the blame on drug use. They put it on alcohol. They put it on other environmental factors.
Yeah.
They won't talk about sugar.
Mm.
But nothing was ever done. Okay, they put out there and they said, if we don't address this oral hygiene issue, we're going to have all kinds of chronic illnesses, heart disease, diabetes, arthritis, Alzheimer's. You go down the list. All of these diseases have oral systemic connection.
Yeah, I have actually another episode on the podcast with an integrative dentist, and we just kind of talk about how people in America, especially, really separate their oral health, right, from the rest of their body. That's even our insurance does that, right? So, yeah, and hopefully we'll start waking up to the connection of our oral health and the health of the rest of our body.
Well, an interesting point on that, again, coming back to COVID, because everybody knows, everybody got involved in that. But in 2020, there were two papers that came out. One of them came out of Israel, the other one came out of Canada. And in those papers, what they showed was that people that had periodontal disease, which is just inflammation of the gums, people that had periodontal disease were 8 to 9 times more likely to be hospitalized and die from COVID than people who had healthy mouth.
Wow.
How many times did you hear the Surgeon General, Vivek Murthy, or the head of the CDC come out and say, people, we know we want you to stay home and eat pizza, but brush your teeth? They never, not once, because our pharmaceutical industry and our public health agencies are so commingled that they're not talking about hygiene. They're not talking about sanitation. They're talking about pharmaceutical solutions for everything.
Yeah. And so, I mean, you being someone who continued to speak out and share data, and try to let people know about these alternatives and ways that they could not only, protect themselves or reduce their risk of a viral infection, but, just improve their oral health in general. Like, you really got seriously censored for sharing the truth about those things, and I'm just curious, like, on a personal level, like, how did that feel to kinda have that censorship put on you like that?
I don't know if I should say this in public, but because my disdain, I guess,
Mm.
for government employees. You know, you've seen the TV show The Office,
I have, yeah.
okay? I used to think that government employees were kind of like, you know, I'm trying to think of a better analogy. Okay, you've seen more Jack Ryan movies, like, kid. You think Jack Ryan movies, Tom Clancy's?
Yep.
Okay, we all want our government employees to be like Jack Ryan, right?
Yes,
We want that's what we want. That's what we would love to have. But instead, most of them are like the people from what we realize is that most of them are from The Office. And a lot of them are really just demons that I think there are a lot of people in government agencies that are doing stuff deliberately to cover their own butt when they make a bad mistake. And what I mean by that is Keith Fenton Miller and Richard Cleland, the two attorneys that really pushed this lawsuit. Um, they should have. I mean, it doesn't take. I mean, you can explain hygiene to a 5-year-old, and they understand what it is. Okay, when you sit here and say, you know what, you're breathing in a virus that comes in through your nose and your mouth, so you should probably use something in your nose and your mouth that washes it out. A 5-year-old understands that. Okay,
yep.
make a statement like that, and these supposedly educated attorneys go out and say, no, it's wrong because it's not in the news. They can't understand that. But
Right.
and there are people that I think that they make mistakes, and rather than owning it and saving the country money and saving lives by owning a mistake and saying, "Hey, we're sorry, we're wrong," it's all good.
Right.
They drag it out because it's not their money. They don't have risk. And so in that, you have, we would like them to be Jack Ryan. Most of them are people from The Office, but some of them are the worst villain that we could ever think of.
Mm.
So,
Yeah. Yeah. Well, I can't imagine how hard that's been, not only on a business level, but on a personal level, to kind of be attacked like that and to, have such, I don't know, just ignorant claims and accusations brought against you. But I really admire you taking a stand against really the money driven, agenda of
what our government is kind of attached to with the pharmaceutical industry and everything. So I appreciate you being someone who can take a stand for that.
Well, I would like to see Kennedy succeed. Um, I think that if he is going to succeed, somebody needs to let him know, because I've been to some of these meetings and they're talking about nutrition, which I think is important, obviously. Cutting down some of the vaccines that haven't been safety tested. That I don't know if they cause all the issues they do or not. I don't know that. I don't. The thing is I don't know that anybody knows it for certain. But we should actually be investigating into it and trying to find that out, not ignoring it.
Yeah. Which kind of brings me to a question I really wanted to ask you as a person who's been in the health and wellness space for a long time is those who are listening who might be kind of new to their health journey, trying to improve their health using more natural products and stuff. What tips would you give them for, trying to take steps in that journey? What are some things that you do or that you would recommend?
Um, well, I used to get sick a fair amount, just like everybody else does. Um, and that's a good question because since I started using xylitol, I mean, so when it comes to systemic health, going back to what the Surgeon General said in 2000, your mouth and your nose is a lot. I mean,
Yeah.
think all of the times that you go and see a doctor, all of the times you get sick, where does that pathogen enter your body? I mean, it's not going through your hands. You can wash your hands all you want. You can take a shower. It's not going through there. Okay. If it gets in through your eyes, it's going through your lacrimal ducts into your nose.
Mm.
So your nose and your mouth. That's really it. Unless it's a urinary tract infection. Okay. But so if you really want to get in there and do as much as you can to change your health, the first thing that you need to do is you do need to practice better oral hygiene and nasal hygiene. And a lot of people they don't understand it. And I've explained this to a lot of doctors and a lot of dentists. And so don't feel, I don't want your listeners to feel like they don't understand it because even the healthcare providers don't. But think of your tissue as a bunch of beach balls, and each of those beach balls is a cell.
Hmm.
And take 100 of them, fill them up halfway full with water, and if you stack them up and hold them in place, and then you spray them with a garden hose, no water gets through because they're all mushed in there together, and it's making a very solid membrane of tissue that stops bacteria and viruses and water and fluid and everything else. But if you fill those beach balls full, you inflame them, then what do you have? You have huge gaps between that tissue and bacteria and viruses. Going back to what I just said about the COVID, if you have periodontal disease, just inflammation in the mouth, you're 8 or 9 times more likely to die from COVID than if you don't. And the reason is because when you blow those up, bacteria are a lot smaller in our tissue and so are viruses. They get through that tissue and into your bloodstream a lot quicker. And so the first thing to do is make sure that your mouth is healthy, make sure your nose is healthy. I would then, pay attention to what you're eating. And, you know, there's a lot of people out there, and this is my opinion. I know a lot more about oral and nasal hygiene than I do about nutrition. Um, but, a long time ago, I just ate whatever was put in front of me and I was a little overweight like I am now. Um, and I read this book, and there's a whole story behind why I read it, but it's called The China Study. Have you ever heard of that book?
I've heard of that book. I haven't read it personally.
So it really convinced me to become a vegetarian.
Mm.
And I was like, "Man, I gotta" so I was vegetarian, and within months, I was like 330 pounds. Like, I was big, like, bigger than I am now. A lot.
Wow.
Um, and so, obviously, being a vegetarian didn't work for me. I have a neighbor who is a vegetarian. He's been a vegetarian for 30 years, and he's healthy. And so the next thing that I would say on a person's health journey is find something that works for you.
Mm.
I mean, if you're not gonna get up in the morning and go work out, then you should probably be counting calories a lot more than somebody who's willing to wake up in the morning and go work out. there's this whole thing. I never really thought about the whole seed oil thing, the difference in these oils up until, 2 years ago.
Yeah,
I don't have any seed oils in my house anymore.
right. Big deal.
I cook with avocado oil. I use olive oil, avocado oil, and coconut oil sometimes. That's really what I use.
Yep.
But
Sounds like my house. Yep. We use a lot of those oils and good quality animal fats to cook in for sure.
yeah, and so I eat mostly meat and vegetables. I don't eat that much fruit. I have 2 children. I'm divorced, and so I have them all summer, and then I have them every other week during the winter. And when they're with me, they're young growing children, and so they have different dietary needs than what I do. I mean, I'm old and decrepit, uh, but I buy fruit for them, and I cook them. They eat more bread than I do, and when they're with me, I kind of eat what they eat because I wanna eat with them and together with them, so I just eat smaller portions. But you have to find something that works for you. We just have to take accountability ourselves for for ourselves and our children to go down that health journey and figure out what works for us.
Mm.
We can't impose that on other people.
Right.
And it would be wrong for our government because what our government does is, they want a one size fits all. You go get this vaccine, this is works for you, it works for everybody, everybody's gonna go get it. And it may be that 10 million people are gonna get hurt and die from it, but the other 330 million are gonna be better. So take a hit for the team. Well, it's all great if you're not one of those 10 million people.
Yeah.
I don't
Well, the bad thing is they keep that information from you, right? People should just know that information, right? Here's the risks, here's the benefits. You make a choice that's good for you.
I think that our people in public health have just come to the conclusion that that everybody in America is just super lazy, and all we wanna do is sit on the sofa and eat pizza and order Uber Eats or takeout or, Domino's or something, and that's, they helped us with that in 2020, but
Yeah, for sure. I don't hear I think there are people like that, but there's a lot of people that aren't like that. There's a lot of people that are getting more educated and wanting to make better choices.
there is, and you know what? I also think that if our public health agencies took some of their budget and actually went and hired the people that were doing the tobacco. He said, "Hey, find a way to motivate these people to be healthy.
Yeah.
The people that are doing the sugar industry, the people that are, in the candy industry,
Right.
um, steal the people from Doritos
Yeah.
and get
Well,
them,
luckily, a lot of the people from the tobacco industry did go to the ultra processed food industries.
but to get those people, and our government can get those people to figure out a way to motivate us to want to be healthy.
Right.
I mean, if people really understood that, right now in the United States, we spend 20% of our GDP on healthcare costs, correct?
Yep.
If if we and I know and I understand, and some people will come out and say, "Oh, that's macroeconomics, it's not micro." And I understand that they don't translate directly, but if you take that macrocosm of 20% of our GDP and you take that to your family, okay? Your average family of, 4 or 5, 6 people, 4 people, um, your average household income is 78,000, I think, a year now. For ease of math, I'm gonna say 100,000, so it's a little bit more. But if you take that, $20,000 a year is what you're spending on healthcare. And if you go in and spend some time at the gym and you eat better food, you're giving yourself a $15,000 a year raise.
Right. Yeah. It's life changing. Yeah.
So, the only thing that pisses me off is that, I own a company and so I have to pay for everybody to have health insurance. But you know how many times I've used my health insurance in the past 25 years?
Yeah.
The kids were born. Um, I had to pay the first 5,000 and then, but it's ridiculous. I put so much money into healthcare, into insurance that I sometimes just want to make myself get sick just so I can use. I feel like I'm wasting my money.
Yeah. Yeah. I get it for sure. Since your specialty is kind of in that
oral and nasal hygiene. What does your routine look like for that? Take us take us into your daily routine. What does that look like?
I wake up in the morning. I brush my teeth. I use I spray my nose. I go to the gym. Um, I work out, and I know you can't tell it, but I'm really no, I'm kidding. Um, and then after I eat breakfast, I use a mouthwash. A lot of people brush their teeth after they eat, and that's actually not the best thing to do. I know that a lot of dentists will say, "Oh, that's when you do," but when you eat food, you create acid. The bacteria in your mouth create acid, and that acid does soften your enamel. And over your lifetime, if you're brushing your teeth all the time after you eat when they're soft,
Oh,
uh, you're going to brush away more of your enamel, and it's going to make your teeth sensitive.
very interesting.
Using abrasive toothpaste makes your teeth sensitive. So if you brush your teeth and get rid of all of the stuff before you eat, and then after you eat, you use a mouthwash to clean all that out. And the other thing you're doing is you're utilizing xylitol to get rid of the bacteria. You want to get rid of all the other sugars and the starches and the carbohydrates so that the bacteria don't have any food. And then you go off to work or school or whatever you do. And if you want some candy during the day, you eat some xylitol candy. If you want some gum, you eat some xylitol gum.
That's right. That's what I keep in my purse. Keep your spry gum in your purse all the time.
And then in the evening, you do the same thing. I mean, I use Xlear before I go to bed. If I work in a hospital or if I'm traveling, I'll carry a bottle and I'll use it then too.
That's a great idea.
But washing your nose it takes you literally 5 seconds.
hmm
It's I'm trying to find a bottle with a label on it. I different ones over here, but they're all,
Yeah. So you're using xylitol. We talked about this at the beginning of the conversation. You're using xylitol to, yeah, instead of fluoride, right, or whatever other people use for their oral microbiome. Are there any cons to using xylitol?
costs.
Cons, any like negative?
And using it in oral hygiene products, there isn't. If you're using it as a sweetener, as a bulk sweetener, which a lot of people do, it can give you an osmotic diarrhea because one of the things that xylitol does is it pulls moisture toward it. And so if you have dry mouth issues utilizing xylitol, most of your dry mouth products on the market, in fact, I'm going to say all of them that I'm aware of, they all utilize xylitol because it makes it sweet and it makes it moisturizing. And we have some dry mouth products also. But the xylitol works differently. And I use this analogy sometimes, but if you think of your tooth as a castle sitting on a hill, and around that hill, you have this army of invading bacteria. If you're just using fluoride or hydroxyapatite or calcium trimetaphosphate, if you're just using something to make your enamel stronger and you're not addressing the bacterial infection, that's like sending a mason out and telling, hey, repair the castle while we're under attack.
Mm,
That's a pretty dumb thing to do. Get rid of the invading army and then have the mason go out and make it stronger.
yeah.
So, but what xylitol does is it does get rid of that invading army of bacteria.
Okay. So that's how it works in your nasal hygiene as well.
Yeah.
Yeah. Okay. Good to know.
The studies that they've done, it blocks bacteria, it blocks viruses. The FTC, when they came back to us and said, "Hey, you didn't do a study on human airway tissue," because a study that was done at University of Tennessee was actually done on barrel kidney monkey tissue, something, which is the industry standard for the pharmaceutical industry.
Mhm.
The FTC comes back and says, "No, you have to go do it on human airway tissue. We're holding you a nasal spray with that's been used for 20 years. We're going to hold you to a higher bar than what the FDA holds the pharmaceutical industry to. So you have to go and do it on human airway tissue." And I'm kind of glad they did because we went back and we looked at a number of different sugars and we looked at a number of different viruses. And what we found is that there are different sugars that block adhesion of different viruses better than others.
Mm.
Okay. The thing is that the COVID virus, the SARS-CoV-2 virus, the coronavirus, all of them block that. But other ones block RSV better. Other ones block H1N1, H5N1, the avian flu, the bird flu. There's sugars that block that too. So we know that the interesting part of that is that different sugars affect the ability of different pathogens to adhere. And I think that that's a huge, space that should be researched further.
Yeah.
The problem is it won't be because you can't patent it. You can't. And so I want to just explain this. And if people decide to go, I would love to have people go and read what's on our webpage. We have all of these studies that I'm discussing. There's links to all of them on our webpage. But um, the reason why sugars matter, you've all seen all the images of the spiked protein. Okay. The spike protein isn't actually what attaches. That's what they're saying it is. But around the spike protein, you have what's called a glycocalyx. Okay. And it's just a sheath, but that's the sugar molecules. The sugar molecules are what actually attach to the tissue. It's not the protein. You have it's it's a glycocalyx, but it's I'm trying to remember the word. Around it, over all these tissues is what they call a glycocalyx, and their sugar molecules. It's the sugar molecules that are actually attaching to the tissue. It's not the proteins.
Okay.
Sugar molecules are just much, much smaller than the proteins, and you can show the proteins. The glycocalyx is what goes around the outside of it.
Okay. Very interesting. Thank you for doing all that research for us.
I'm not a scientist. I'm a welder.
Well, this is I mean, but I don't know how you remember everything. Like I'll read all these studies and stuff like that, and then I have to go back and read it again to remember all the dates and everything. So this is a wealth of information.
You know what they say, if you want to learn something, you can read it, but if you want to remember it, you have to teach it. And I've spent 25 years teaching the whole concept of oral and nasal hygiene and reducing inflammation and actually treating the bacterial infection that's causing the inflammation to doctors and dentists. So I do have a fairly good understanding of it.
Yeah. I appreciate you explaining it to us so well. And if people want to find your products and get connected to you, how can they do that? What's the best way?
Just go to our webpage, Xlear, .com. You can buy our products, our nasal spray products, the Xlear products. You can buy them everywhere. CVS, Rite Aid, Walgreens. And I just want you to make sure that people, if you have any questions about it, I don't want you going down there and buying it just to buy it and let it sit on the shelf. If you really understand the concept of nasal hygiene, oral hygiene, and you want to do it, I would highly encourage you to do it because you will see the benefit. One of the other benefits that we didn't even talk about is it opens up the airway so you breathe better. They have studies where they've gone and they've used our nasal spray, and then in a matter of minutes, they're improving their airway volume by 20%.
Wow. So if someone is already experiencing symptoms of a respiratory virus, can it also help? Yeah. Yeah.
You want to use it. I mean, you don't wait until you're sick to wash your hands. You don't wait until you have a cavity to brush your teeth, but it does help once you do get it.
Awesome. Okay. Well, we'll put all that information in the show notes. Thanks again for your time, for sharing your wisdom and your story with us. I really appreciate you.
Anytime. Thank you.
Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.